Let's delve into the world of health and explore why, despite our best efforts, our legs can feel weak, stiff, and unstable. It turns out that it may not just be about age or lack of physical activity. The culprit could be vitamins, those very substances that are supposed to strengthen the body. But how is this possible? Some popular vitamins, if used incorrectly or in excessive amounts, can harm nerves, weaken bones, and reduce muscle control, which is especially important with age. Vitamin E is in the spotlight. Taking high doses of vitamin E can weaken leg strength, damage nerves, and increase the risk of balance problems, especially in older adults. Taking more than 300 milligrams a day, which is approximately 400 to 800 IU, offers no proven benefits for muscles or mobility and may cause harm over time. Clinical reviews show that large doses of vitamin E are associated with muscle fatigue and weakness. But that's just the beginning. What other vitamins can secretly undermine leg strength, and what can be done to avoid this? Pharmaceutical guides from the United States warn that excessive consumption of vitamin E is often accompanied by fatigue, muscle pain, and decreased endurance in the lower extremities. Such phenomena are not typical of a normal diet but become noticeable when significantly exceeding the recommended daily doses in the form of supplements. Excessive doses of vitamin E can disrupt neuromuscular transmission. Scientific studies indicate that prolonged intake of supplements can provoke the development of moderate peripheral neuropathy, which manifests as decreased sensitivity in the lower extremities, slowed reflexes, and impaired coordination. Vitamin E, while playing an important role in protecting nerve fibers at adequate levels, can disrupt the transmission of nerve impulses in excessive amounts, leading to a weakening of control over the movements of the feet and legs. It should be noted that high doses of antioxidants, including vitamin E, do not improve physical fitness in older adults. Results from randomized controlled trials conducted among well-nourished elderly individuals demonstrate that megadoses do not strengthen muscle tissue or reduce the risk of falls. A meta-analysis published in 2005 in the journal Annals of Internal Medicine revealed a slight increase in the risk of mortality among adults taking more than 400 IU of vitamin E per day compared to those consuming lower doses. These data have raised growing concerns in the medical community regarding the safety of long-term use of vitamin E in large amounts. Another often overlooked danger is the effect of vitamin E on blood clotting. An excessive amount of this vitamin can disrupt the action of vitamin K, an important element for normal blood coagulation, which increases the risk of internal bleeding. In some cases, excessive doses of vitamin E have been associated with hemorrhagic stroke, bleeding in the brain, which can cause sudden loss of motor activity, paralysis, or even death. For older people, even minor bleeding can seriously affect the functionality of the lower extremities and the ability to move independently. The upper tolerable limit for vitamin E intake is 1,000 milligrams per day, which is approximately 1,500 IU. However, most dietary recommendations advise much more moderate doses, about 15 milligrams, 22 IU, per day for adults, emphasizing that high doses do not provide additional benefits but carry an unjustified risk. Many over-the-counter supplements contain from 200 to 1,000 IU in one capsule, which creates the danger of exceeding safe levels without realizing it. Older people are particularly susceptible to the negative consequences of excessive vitamin consumption. With age, muscle mass naturally decreases. Any substance that impairs the nervous system, disrupts blood circulation, or causes muscle weakness can quickly lead to weakening of the legs and decreased mobility. To maintain muscle strength and balance, older adults should avoid taking large doses of vitamin E, except when under strict medical supervision. Getting vitamin E from natural sources such as sunflower seeds, almonds, spinach, and vegetable oils is generally safe and effective. Taking vitamin supplements should always be coordinated with a doctor to determine the optimal dosage. Vitamin A, also known as retinol, can have a negative impact on the skeletal system when consumed in excess. Exceeding the permissible doses of retinol leads to weakening of bones, increased risk of fractures, and limited mobility. Older people, whose bone density naturally decreases with age, are particularly vulnerable to this effect. Excessive retinol consumption disrupts the natural balance of bone metabolism, shifting it towards bone destruction instead of strengthening it. Clinical observations indicate that prolonged use of high doses of vitamin A causes bone thinning, joint stiffness, and pain caused by inflammatory processes in the connective tissues around the joints. Such changes weaken the structural foundation of the legs and hips, making them more prone to injury. Large-scale population studies confirm a direct link between high retinol consumption and an increased likelihood of hip and leg fractures. For example, one Scandinavian study found that adults who consumed more than 5,000 IU of vitamin A daily had twice the risk of hip fracture compared to those who consumed less than 1,600 IU. In the American Nurses' Health Study, which included over 70,000 postmenopausal women, it was found that those who consumed an average of more than 10,000 IU of vitamin A per day had a significantly higher risk of hip fracture than women who consumed moderate doses of this vitamin. The data convincingly demonstrate that high doses of retinol harm bone strength, even in people without other health problems. In older adults, bone fractures often lead to prolonged recovery, dependence on assistance, and, unfortunately, irreversible loss of mobility. A hip or leg fracture can end independent walking. However, even in the absence of fractures, excessive consumption of vitamin A can trigger long-term problems. Systematically exceeding the recommended doses of this vitamin leads to weakening of the lower extremities, discomfort when walking, and difficulty climbing stairs. As shown by animal studies and observations of humans, excessive consumption of retinol leads to a decrease in bone density and the occurrence of spontaneous fractures not associated with trauma. This deterioration in bone quality negatively affects the ability to bear weight, maintain balance, and move safely. Older people may not immediately feel the effects of excess vitamin A, but over time, with regular intake of high doses of supplements, leg strength weakens and the risk of injury increases. A safe upper limit for vitamin A intake in preformed form is considered to be 3,000 micrograms per day, 10,000 IU. It should be noted that many multivitamin complexes already contain 2,500 to 3,000 IU of vitamin A, and additional intake from fish oil, or fortified foods may lead to exceeding the safe level. It is important to remember that vitamin A accumulates in the liver and, unlike water-soluble vitamins, is not easily eliminated from the body. Vitamin A deficiency is certainly a problem, but excessive consumption is much more common, especially among those who are fond of taking supplements. Older people should avoid high doses of retinol unless strictly medically necessary. Beta-carotene, a plant form of vitamin A, appears to be a safer option, as the body converts it to retinol only as needed. Vitamin B6, a cornerstone of nervous system health, harbors a paradox. In excessive doses, it can harm the very nerves it is meant to protect. Prolonged abuse of supplements containing this vitamin is fraught with the development of peripheral neuropathy, damage to the nerves, most often starting in the lower extremities. People who take high doses of B6 for several months often experience unpleasant sensations such as numbness, tingling, or burning in the legs. Some patients describe this condition as legs falling asleep or loss of the sense of foot position when walking. Unfortunately, these first warning signs often go unnoticed, which can lead to disability. Numerous scientific studies confirm a direct link between excessive consumption of vitamin B6 and nerve damage. In particular, prolonged intake of doses ranging from 300 to 500 milligrams per day provoked loss of coordination, difficulty walking, and impaired balance. In particularly severe cases, patients developed an unsteady, uncertain gait, depriving them of the ability to move independently. It is important to emphasize that such negative consequences are caused not by a deficiency, but by an excess of vitamin B6, which simply overloads the nervous system, leading to its dysfunction. Although relief of symptoms may occur after stopping the supplement, the recovery process often requires a significant amount of time. In older people, the regeneration of nerve fibers is slower, and in some cases, the damage may be irreversible. Older adults with pre-existing minor nerve disorders caused by diabetes, circulatory problems, or past injuries are more susceptible to severe consequences from excessive vitamin B6 intake. The recommended daily intake for adults is approximately 1.5 to 1.7 milligrams, while the safe upper limit is set at 100 milligrams per day. However, many energy supplements and nerve support formulas contain significantly higher doses, sometimes exceeding 200 milligrams per tablet. Some consumers take these daily without realizing the potential danger. Even relatively small doses can trigger symptoms in susceptible individuals, especially with prolonged use. Unlike some nutrients that accumulate in the body gradually, nerve damage from excess vitamin B6 can occur suddenly and unexpectedly. One day, your gait may seem normal, and the next, your legs feel weak and unsteady. It's important to understand that this isn't an inevitable consequence of aging, but a direct result of excessive consumption of a specific vitamin. Danger signals that should not be ignored include tingling sensations in the lower extremities, impaired coordination in low-light conditions, frequent loss of balance, and difficulty determining the position of your feet while walking. These are all alarming symptoms indicating potential problems with the nervous system. Ignoring these signs can lead to serious falls and limited mobility. To maintain leg health, older adults are advised to avoid uncontrolled intake of high doses of vitamin B6 supplements unless prescribed and monitored by a qualified physician. Obtaining vitamin B6 from natural sources such as poultry, bananas, potatoes, and fortified cereals is safe and sufficient for most people. Vitamin supplements should be carefully considered, especially if used for more than a few weeks. Equally important is vitamin D, which plays a key role in maintaining bone strength and normal muscle function. However, prolonged use of high doses of this vitamin can do more harm than good. Excessive vitamin D intake leads to calcium buildup in the blood, known as hypercalcemia. This condition directly impacts muscles, including those in the legs. Early signs of vitamin D toxicity often manifest as muscle weakness, increased fatigue, and cramps. These symptoms are most pronounced in the lower extremities. Individuals may experience heaviness while walking, tremors in the calf muscles, or wake up at night due to muscle spasms. Numerous medical reports unanimously indicate that excessive vitamin D consumption negatively affects muscle tissue contraction and relaxation processes. Elevated calcium levels in the body disrupt normal nerve impulse transmission, leading to impaired coordination. In particular, older adults taking significant doses of vitamin D often complain of feeling unsteady, especially when standing up or moving on uneven surfaces. In severe cases, this imbalance can trigger falls, loss of independent mobility, and, consequently, hospitalization. One scientific study involving elderly women showed that a single high annual dose of vitamin D at 500,000 IU not only failed to reduce the risk of fractures and falls, but, on the contrary, increased their occurrence. Another analytical review noted that long-term use of more than 4,000 IU of vitamin D per day by the elderly provides no additional benefits but increases the likelihood of adverse side effects. These data challenge the widespread belief that increasing vitamin D intake always positively affects bone health. Hypercalcemia caused by excess vitamin D can also cause nausea, negatively affect the kidneys, and lead to confusion. However, the most dangerous consequence for older adults is impaired muscle control. Calcium buildup in soft tissues, particularly muscles, hinders their normal function. In the lower extremities, this can manifest as stiffness, weakness when climbing stairs, or a slow, shuffling gait. Medical experts have established a safe upper intake level of vitamin D for adults at 4,000 IU per day. However, supplements containing 5,000 IU or more per capsule are widely available. If such doses are taken daily and without monitoring, blood vitamin D levels can eventually reach toxic levels. Older adults with kidney disease, magnesium deficiency, or dehydration should exercise extra caution, as they are more susceptible to negative effects. The reduction in muscle mass that inevitably comes with age is already a significant concern. Excessive vitamin D intake only exacerbates the risk of weakness, impaired coordination, and injuries. In the most unfavorable scenarios, a beneficial vitamin can become an obstacle to an active lifestyle. To maintain health and mobility, it is recommended to adhere to a moderate and consistent vitamin D intake. Most older adults need only 800 to 1,000 IU per day, unless a doctor prescribes a different dosage based on blood test results. It's important to remember that increasing the dose doesn't always lead to improvement, and maintaining a healthy balance is essential. Vitamin C, known for its ability to strengthen the immune system, can also pose a hidden danger if consumed excessively, especially in doses exceeding 2,000 milligrams per day. There is a common misconception that water-soluble vitamins are always safe. However, prolonged abuse of high doses of vitamin C can disrupt mineral balance and connective tissue function, which, in turn, can negatively affect muscle strength and joint health. One of the key problems associated with excessive vitamin C consumption is its effect on copper levels in the body. Excessive intake of this vitamin can lead to decreased copper absorption in the intestine, which can negatively affect health. Copper is an important trace element that plays a significant role in maintaining the elasticity of blood vessels, ensuring the health of the nervous system, and forming collagen. Copper deficiency can lead to weakening of connective tissue, which can negatively affect the condition of tendons, ligaments, and joints that provide stability and mobility to the legs. Studies show that copper deficiency caused by prolonged intake of high doses of vitamin C can provoke various unpleasant symptoms, such as joint pain, delayed wound healing, and even changes in bone tissue resembling osteoporosis. In older adults, this can manifest as instability in the knee joints, slow recovery from sprains, or unexplained soreness in the ankles and hips. In addition, copper plays an important role in ensuring normal nerve signaling and the restoration of myelin, the protective sheath of nerve fibers. A decrease in copper levels can lead to a slowing or weakening of nerve impulses in the legs, which can manifest as numbness, a feeling of heaviness in the legs, or impaired coordination. Often, such symptoms are mistakenly associated with age-related changes or circulatory problems, while the true cause is an imbalance of nutrients in the body. Excessive enthusiasm for vitamin C is not without potential risks. In particular, it can provoke the formation of kidney stones. Although this process does not directly affect the strength of the lower extremities, the accompanying dehydration and electrolyte imbalance can cause cramps and spasms in the legs. Such muscular manifestations are especially common at night, disrupting sleep and full recovery of the body, which is especially undesirable for older people. It should be emphasized that vitamin C from natural sources, fruits and vegetables, is certainly beneficial. However, uncontrolled intake of this vitamin in increased doses does not bring tangible benefits to most older adults. Moreover, there are clear recommendations. The daily intake of vitamin C for adults is only 75 to 90 milligrams, and the upper limit of safe consumption is set at 2,000 milligrams. Many powders, effervescent tablets, and immunostimulating mixtures containing vitamin C offer a dosage exceeding 1,000 milligrams per serving, and some consumers take them several times a day. Prolonged use of vitamin C in such quantities, especially without prior consultation with a specialist, can lead to discomfort in the legs, mineral imbalance, and impaired joint function. Older adults who already have a predisposition to osteoporosis or decreased functionality of connective tissue are particularly vulnerable to such negative consequences. To maintain the health of the lower extremities, it is recommended to get vitamin C from natural sources, such as juicy oranges, ripe berries, crisp bell peppers, and fresh leafy green vegetables. These products are not only rich in vitamin C but also contain additional antioxidants, fiber, and other valuable nutrients that, together, ensure optimal absorption and a balanced effect on the body. If vitamin supplements are needed, it is essential to strictly adhere to the recommended dosages and consult with a qualified healthcare professional beforehand. It's important to remember that not all vitamins are equally beneficial, and not all supplements have a positive effect on the body. Improper use of even the most common vitamin complexes can weaken the legs rather than strengthen them. The key factor is not only the choice of supplements taken but also their quantity, timing, and justification for use. These nutrients can either support mobility or gradually impair it. The most sensible step is to consult a doctor. It is necessary to regularly monitor health indicators and review the supplements being taken. What is effective for one person may be useless or even harmful to another. In-depth knowledge and a properly selected dosage, taken at the right time, can play a decisive role in protecting the lower extremities, maintaining balance, and preserving independence.